Protection can be from, we are now looking at the role, protective role of the skin, protective role. One, from infections by forming a barrier which hinders passage of pathogens. Or germs. So in case the skin gets damaged, then it exposes, like in the scenario that I've said, it exposed. The tissues which are below the skin are delicate. They can be infected easily by the pathogens. So meaning that one of the health problems that can result from the abrupt destruction of the skin is infection. As we have said, infection due to the destruction of the barrier, which allows passage of pathogens that then damage the tissues under the skin. Solution to this, we can take person for treatment with antibiotics. To kill the pathogens. Avoid infections. Another protective role is that the skin protects the inner tissues from physical damage, physical or mechanical damage. There are other functions of the skin, but according to the scenario, this is what basically we are looking at. I think another one that we are looking at is physical damage. Obviously, before the inner tissues are damaged, the skin is always there to sacrifice itself. Then another role will be that the skin also, when you cover this, we say that the skin is also keratinized. That is on the side of physical protection. Then also the skin has glands, is oily, and this one is to reduce water loss. And that's why when your skin gets damaged, you find that place turning watery because water is easily getting lost. So we also have another problem, that there's a problem of dehydration due to the exposure of the tissues that do not have protection against water loss. So I expect it on the skin alone. I expect to see this, I expect to see this, I expect to see this. So how can you overcome dehydration? The person should take more fluids. Take more fluids to rehydrate. On the skin, in case somebody has a question, please. Any question about the skin? The first problem that we'll be looking at. Nkunda, Mariam, give me some question. Something that you want to understand about the skin concerning the scenario. So this explains why the first the first time you get a problem with your skin or skin damage, the first thing they will do is giving you an antibiotic to destroy the germs that must have escaped antibiotic. And the most common germs are the bacteria. Obviously, you have also fungi, viruses. Remember, antibiotics can be broad spectrum. Broad spectrum means that they can destroy both. They can destroy bacteria, viruses. They can destroy fungi. So for the skin part, I think we are done with the skin. The next part which were affected is what we are going for. Unless someone has a question in there. Michael, do you have a question? Priscilla, gift. Now, Nabazira gift. Ask a question where I need to give. Have we generated the answer for the part of the skin? The first part of the question is saying, you are saying, explain why this person's health situation should be worrying. So this explains why his wounds became worse and lethal. It is because of the infections, possible infections. Dehydration, remember the role of water. Dehydration means that if water is lost, the person is going to suffer. Okay, the solids will not be dissolved, substances will not be dissolved, chemical reaction cannot take place in the body. With the chemicals of life, you understood the role of water. And if water is lost, still the cells will lose their structures. They get dehydrated and lose their structures. That is enough to stop chemical reactions from taking place. And when you read the syllabus book, they are saying analyze the structures and then how they affect all of their roles in the physiological processes, disease diagnosis, and level of organization. The learners must understand, develop the skill, have the value, and they can apply. That is USVA. Now we hand another part. This number is for the question. Yeah, they have the question. Hey, it's okay. As you can. So those people without the question, they're putting the question says that we are at the same page. That's right. Mm. Okay, we move to next structures. The next structures I have here, I have. I'm now removing the work unless you have some other question to ask. Teacher, what is the solution to the problem of physical damage to the inner tissues? I think the solution is just facilitating healing. What can we do? We can take antibiotics to stop further damaging of these tissues by the germs. And then we can also rehydrate, take more fluids to rehydrate. Now, that one you answer it by looking at how can you promote healing, the healing process. That's what we can do. That's what I say that one is take antibiotics. The healing will take place ideally, the master have also told you about cell division. You look at natural healing. The healing occurs naturally. You take you take antibiotics just to prevent interference. However, if it is big injury, that's when you would say maybe a surgery to replace the lost tissue, but yes, it is the skin. So there you can't go for surgery for skin. But however, you can put it there. Now the world is changing. That's the only question we have. Can I remove the work? So the next parts which were affected were the person has few rough endoplasmic reticulum. The person has few lysosomes. Lysosomes. The person has a few mitochondria, other mitochondria. Now, when you cover this with Mr. Collins, you must have looked at the functions of each organelle in supporting the health of the person. The reason why we are studying this, we are looking at what do these things do to make us live a healthy life. So for example, rough endoplasmic reticulum, once there are few, what happens, which processes are affected? So you should be in position to give us the processes affected. That's why the syllabus book says physiological processes. When you go to the hospital and they diagnose you and then they tell you now you have few rough endoplasmic reticulum, we have few lysosomes in your cells, mitochondria are so few, then you should be knowing that now, if mitochondria are few, meaning that respiration is going to be interfered. And if respiration is interfered, then you will not get energy. You'll not be able to have energy. Energy supports the ATP formed. The energy formed supports very many processes in the body, including cell division, which is a process that through which healing occurs naturally. Cell division, natural healing. So tissues divide. cells divide to replace the one that have been destroyed. So in case this ATP, this one here, the process interfered with is respiration. When you cover respiration, you will find out that aerobic respiration occurs only if aerobic respiration occurs in both the cytoplasm and in the mitochondria. And this one produces a lot of energy. And in case the mitochondria are destroyed, then it means you're going to respire only anaerobically. Anaerobic respiration. And this one produces very little energy, and that one will affect your normal body processes like cell division. For example, in this scenario, we are looking at healing, and the process that can be supported here is cell division. That is, according to the scenario, healing process. So we also wanted to see that a person will know that since this one has been destroyed, obviously the respiration will not take place, or there are few, meaning that respiration will lower, shall have lowering of this, not completely stopping, but lowering, producing little energy, which will not support fast cell division to cause healing. Fast cell division to cause healing. That is for the mitochondria. So the first challenge here that is going to face is slow healing. Why? Because the mitochondria are not producing enough energy to support fast cell division. To produce, or you can be specific, to support fast mitosis, produce cells at a faster rate to replace the cells that were damaged. And when you study the skin, you must have seen a video. For those people, when you're at home there, please type in a video, YouTube. You can see the healing of the healing process by the skin. You will see cells dividing naturally by mitosis. But in presence of energy, then for lysosome, what is the work of lysosome? Lysosomes, their work is to destroy worn out cells. For example, in this process, worn out cells, there are very many cells that are worn out or dead. Now they must be destroyed. Now, if the lysosomes are few, it means that this function will be compromised. And these lysosomes also they destroy pathogens, including harmful waste, not like perosomes. Perosomes, for them, they oxidize. Now, if these ones are also destroyed, meaning that the healing process also will delay, because those dead cells will not be destroyed. And the dead cells will encourage much more infection if lysosomes have been compromised. So the less lysosomes, the more infection. Why? Because the dead cells are not being destroyed. The pathogens are not being destroyed in the cells. When you read that cell biology, they said these lysosomes produce hydrolytic enzymes. Those hydrolytic enzymes can destroy pathogens by forming vesicles and then destroying those vesicles in the cell. So you find that there's compromised destruction of the dead cells, and this one encourages more infection, slow healing, and that's why we should be worried about this boy's health. And since if infection is maintained, then it will spread to other organs, as long as you provide a medium where the bacteria can reproduce. For example, the dead cells can provide nutrients for the bacteria to multiply very fast. So that's why when you go to the hospital, they must clean the wounds to remove those cells that are already dead. but the body does its natural process, the lysosomes doing the work. Then you have the rough endoplasmic reticulum. For them, what they do, one, being rough, they have ribosomes, and ribosomes deal with protein synthesis, formation of proteins. And these proteins here, some of them form the enzymes that are used by lysosomes, the enzymes that are enclosed in lysosomes. And not only that, the enzyme that catalyze other processes like respiratory enzymes. Meaning, in case this one here their number is reduced, then the rate of production of vital enzymes, vital protein products like enzymes, will reduce, resulting into reduction in the metabolic processes. For example, respiration, destruction of pathogens, all that will be compromised. So all this takes us back to how the destruction of these structures here, or their role in maintaining our health. So that's what the question was looking at. The question was testing whether learners can, because the questions always they can bring scenarios where they show you signs and symptoms of showing waste accumulation. And you should be knowing which organelles deal with the waste. Or the scenario where the cell is no longer able to catalyze metabolic processes, meaning that the rough endoplasmic reticulum has been what? Damaged. They are damaged. They can no longer produce and arrange enzymes, rather arrange proteins to form the required enzymes, and that's their work. So you should be knowing the role of these ones here in physiological processes, because the questions come testing whether you can elaborate the knowledge about the role of these processes, these organelles in physiological processes like respiration, catabolic processes, process of breaking down products. For example, respiration is a catabolic process. Anabolic processes, process of making molecules, substances that are vital like enzymes. So protein synthesis is an example. Like this term, we shall cover the proteins. We shall look at the role of all enzymes and what can inhibit their function. So that is about number one that we shall. Number one needed you to give all that. Then part B, explain how this boy can be helped to restore his body state. We say that he should take fluids to rehydrate. And how does that one rehydration help? Rehydration supplies water that dissolve substances which are used in metabolic processes in cells. This person should be given antibiotics, as I told you, to kill the germs. And then they can dress the wound. They can dress the wound. If they dress the wound, or even sterilize. Dressing and sterilizing the wound, the aim of that is to prevent entry of germs, avoid the infections. So those are some of the answers that I think you can generate for item 1. I think my item I guess out. So for item 1, today we are supposed to look at item 1, and I was waiting for your questions. How do we write answers? I hope you've written the answers. Any question? Or we close the chapter? Are they asking any question? Oh. What of the proteins being used for cell repair? True, it is correct. The proteins that would have been used, because cells are proteins. Proteins are used to make cell structures, plasma membrane, you remember. So it is true. A student will say that because already rough endoplasmic reticulum has been, rather they are few, meaning that they will not produce enough proteins that are required to repair the worn out cells or damaged cells. You should be knowing the components of a cell membrane or the role of proteins in the cell. One is to make the cell membrane, which is part of the cell. So cell division cannot take place when the proteins are not there to make the cell membrane and other organelles inside the cell. So it is true. Any other question? Now, the solution to that, there must, because in the scenario here, we are looking at, I'm seeing the skin damage. There could be the reduction in the number of rough endoplasmic reticulum. Okay, these organelles could be because of the infection, because that is what I'm looking at. Because ideally, the person will not take any solution, will not take any other extra thing. We are just looking at this accident is the cause of everything, possibly. According to the question, because I can't lie you that there's another thing that I can think of that could cause that. Because the scenario should have a lifestyle or something that is happening that can lead to a certain condition. So ideally, that is what I also see in the question. I can't tell you that maybe there's a solution or the cells are doing what. If they had said that the lysosomes maybe are breaking, the bacteria breaking the lysosomes, maybe it could be that the germs are breaking the lysosomes. And maybe they are releasing the cell contents that are destroying the cells. I could have said so, that this is what we could. But now, I think the best thing is now to avoid, after getting the wound, you must avoid the infections by the pathogens. Because the infections by the pathogens for them have different effects. They may be producing enzymes that destroy these structures, yeah, these organelles. The enzyme may not have an effect on the cell, the oral cell, but the enzyme might be produced, might diffuse into the cell and then it destroys the organelles. So the cell ceases to be a cell. Just it is there. So for me, I was looking at the basic things, first of all, to avoid infection. When you get a wound, is always to rush you. They rush you to the clinic and they first sterilize the area to remove the infection. Otherwise, you can get other complications. And they will remind you that one time you got an accident and you do not care about it. Even after healing, when the healing process was not okay, the healing took place without treatment, without sterilizing, without yet you got a serious accident. In future, you may find maybe you may find cells begin dividing, they're abnormal, and cancer begins from there. So there are very many effects of not treating, not responding to damage on the body or any complaint of the body. So here, what I'm trying to mean is that always concentrate on the scenario will have the lifestyle or the practice, the action, habit that is not okay, that is affecting the body structures. And if this is there, then for us, when you are giving solutions, our solution, we should target on this. Or you should also target on the effects. There could be effects of the lifestyle. For example, if a scenario was having that somebody is is smoking, and now the lungs have been diagnosed, they are destroyed, then obviously the smoke is releasing the chemical that is destroying the simple squamous tissue on the alveolus. So our aim is now to what can we do? This person should stop smoking, and then this person should go for treatment. Because already destruction of the tissue always gives room for bacteria to multiply. Bacteria survives in such decomposing matter. It will absorb nutrients from those ones there, then they will multiply and attack even the normal cells. And that's why other infections will will come in. So that's why I had to project for you the syllabus book. Obviously, when you are teaching you're supposed to follow that. And also tell you that the reason why you are studying this, you want to become doctors, and you're not going to go with BS to describe how something happens. What the patient wants is to see healing normally, improving the health. That's why they are saying there that to look at the effect in physiological processes, diagnose diseases, and obviously treat them or manage the diseases such that people live a healthy life. So that is why we studied this. So whenever you're studying, those are the questions you're supposed to ask. I believe no more questions. I'm saying any other. Hey, okay. I wish you a nice time. See you tomorrow.